Now we'll discuss about another important topic of GIT disorder, that is antiemetics. So before entering into the actual what are antiemetics, what is the pharmacology of antiemetic drugs, let us see few of the terminologies. So first thing is that act of emesis. What is emesis? Emesis is nothing but a forceful expulsion of gastric contents. So emesis is that it may be drug induced or else it may be human induced also, in the sense we forcefully expel out the gastric contents, but it does not occur naturally. The other terminology is vomiting. Vomiting is a natural expulsion of the gastric contents, and vomiting also is caused by various reasons, but it is caused because of the activation or stimulation of the vomiting center which is present at the chemotrigger zone. The other one is nausea. Nausea is nothing but the feeling or sensation of vomiting. Vomiting doesn't occur, but it's just a feeling that vomiting has been, or else we feel like to vomit. The other one is retching. Retching is nothing but the sound, or else it is the movement of the gastric muscles, or else it is a series of weaker and unproductive vomiting movements. We don't vomit actually, but the sound which we give before we vomit is called as retching. And what is vomiting actually? So this nausea and vomiting, these can be of various reasons, or else this might be because of various reasons, like in the name itself I have indicated what is it because of. So the term vomit, V for vestibular. If there is any disturbances in the vestibular system, that is eye, ear and other sensory vestibular organs, if there is any disturbance in these kind of organs, then vomiting is induced. The other one is obstruction, that is opiates. If opiate induced vomiting, there are few drugs, opiates have the side effects of nausea and vomiting. So if these drug induced vomiting is caused, then it is it induces vomiting. And the other one is mind. If there is any disturbance in the CNS system, central nervous system, then also vomiting is caused. The other one is infection. If there is any irritation to the gut because of the allergens or because of the drugs or because of the various neurotransmitters or chemical mediators which are released into the body, if there is any irritation to the gut wall, then also vomiting is caused. And toxins, there are various other toxins, or else there are free radicals which are released into the body because of various metabolic reactions and chemical reactions which are undergoing in the body. So the toxins which are very toxic to the body and they cause any irritation to any of the system in the body, then also vomiting is induced. So vomiting occurs in three phases. First one is pre-ejection phase, second one is retching, and the other one is ejection phase. So pre-ejection phase is nothing but the gastric relaxation takes place for a moment, and then the peristaltic, there will be heavy peristaltic movement and there will be very discomfort in the GIT system. So in that condition we feel like pre-ejection. We don't actually expel the gastric contents out, but that is a pre-form or else pre-phase of ejection. Second one is retching, that is there will be heavy peristaltic movements and almost the gastric contents will reach up to the oral cavity. And the other one is ejection. Finally the gastric contents will be expelled out of the body if there are any reasons which we have mentioned in the previous slide, that infection or toxins or drug induced or various other reasons. So the gastric contents whatever are there will be expelled out of the body. What are the consequences? What happens if vomiting is happened to a person or if vomiting has occurred to a person? First one is, because of this, the unwanted, in some situations, unwanted body fluids also will be expelled out. So because of that unwanted removal of body fluids, there occurs dehydration to the person. Second one is acid-base imbalance. So when fluids are lost or electrolytes are lost, then there will be pH disturbances and there will be the acid-base imbalance. The pH of the particular region, whether it may be stomach or oral cavity or esophagus or whether intestine, or it may be the pH of that particular region will be altered. The second one is electrolyte depletion. Due to the loss of heavy fluids out of the body, the electrolytes will be lost, and if there are any disturbances in the electrolytes, then there occurs few of the electrolytes will be depleted also. The other one is aspiration and pneumonia. In heavy vomiting condition, in few of the patients, or else in deceased condition, the patients, if this vomiting occurs, there may be chances of pneumonia or aspiration. There will be some respiratory discomfort in that particular patient. What are the causes? How vomiting is caused, or what might be the reasons of this occurring of vomiting? So there are many reasons. First one is chemo trigger zone stimulation. So chemo trigger zone stimulation is, or else CTZ, is a zone which is present in the medulla oblongata of the brain, or else we can say exactly it is located in the area posterior region of the brain. So near to by the CTZ, the vomiting center is present. So this CTZ is present outside the blood-brain barrier, and when it is stimulated, it coordinates or communicates with the vomiting center, and thereby it induces vomiting. And there are various other receptors present on this CTZ. For example, opiate receptors, 5-HT3 receptors, histamine receptors, muscarinic receptors, and there are various other receptors present on this CTZ. So when stimulation of these particular receptors thereby cause stimulation of CTZ, when CTZ coordinates with vomiting center, then vomiting is induced. The other one is disturbance in the vestibular system. So if there are any disturbances which are caused to the sensory organs of eye or ear or nose, then also vomiting is induced. And the other one is high cortical center stimulation. So if there are any CNS disturbances in the central nervous system, there are various nerve centers which carry nerves to brain, ear, and various other parts of the body. So if there are any disturbances occurring in the reflex of these nerves, or else of these nerves in the brain, then also vomiting is induced. The other one is periphery via sensory nerve. So the peripheral parts like pharynx or GIT area, if there is any irritation caused to these organs, also vomiting is induced. What are the types of emesis? How many types of emesis it can be, or when does this emesis can be caused? So there are various types like motion sickness, morning sickness, chemotherapy induced emesis, post-operative emesis, and the other one is vomiting of varied origin, or else we can simplify and say that drug-induced emesis. What is this motion sickness? So motion sickness is nothing but in few of the people, in fact we can say they have a phobia of traveling, or else they have the phobia if they travel in a slopey area or else hilly area, or while landing of the flight or while take off the flight, they feel like they vomit. I mean, it is because in few of these patients they have a phobia because of that, where the brain sends the impulses, or brain sends the signals to the CTZ, where it stimulates and vomiting is induced in few of the patients. The other one is, it is a labyrinth type of vomiting. Labyrinth in the sense it is irregular. We can't predict. It may happen or may not happen, but it's not in a regular basis. It may be irregular. In few travelers it may, in few travelers it not may. But in the same patient also there is a difference. Like in the same patient, if he is traveling for several times, so it is not mandatory that vomiting is induced in all the travels. It may differ based on the condition of the patient, based on the diet what he take, or based on what actions he have done before traveling. So all these come into consideration in motion sickness. And the drugs which are used to treat this motion sickness are H1 receptor antagonists. In H1 receptors also there are two types of antagonists. One are centrally acting, the other one is neuroleptics. So centrally acting drugs are recommended in motion sickness. Second one is anticholinergic drugs. The third one is cinnarizine. It is a plant derivative. The other one is morning sickness. Morning sickness is caused in pregnant women. In first trimester of this pregnancy, the women feel to vomit. So this is called as morning sickness. And the drugs which are used in these are doxylamine, ceclizine, meclizine, and vitamin B6. So when compared to all these drugs, vitamin B6 as well as the doxylamine are the safest drugs in pregnant women. And this vitamin B6, that is pyridoxine, it should be given in the dose of 60 microgram per day. CIE, that is chemotherapy induced vomiting. So in cancer patients, when chemotherapy is given, so after chemotherapy they feel like vomit. I mean, because of the disturbances which are occurring in the body because of the chemotherapy or the laser chemotherapy treatment which is given to that patient, they feel like vomiting. But it is not mandatory in all the patients. It may differ based on the patient body or else the situation in which the patient is present. So this chemotherapy induced vomiting is because of the activation of 5-HT3 receptors which are present on the CTZ. So as I told you, CTZ have various receptors. So one of the receptors is serotonin receptors or 5-HT3 receptors. So when chemotherapy is given to a patient, because of the activation of this 5-HT3 receptors, then emesis is induced. So in order for the treatment of this chemotherapy induced emesis, 5-HT3 receptor antagonists are given like ondansetron, granisetron, tropesetron, palosetron and ramosetron. So these are 5-HT3 receptor antagonists. These are preferred in chemotherapy induced emesis. The other one is post-operative emesis. So in complicative conditions or in surgery, in very high complicative condition, general anesthesia is preferred to the patients. So after the surgery or post-operation, in few of the patients, the emesis is induced because of various other reasons, or else we can say it because of the anesthesia which is given to the patient, the activation of CTZ takes place and emesis is occurred. In this post-operative vomiting or emesis also, 5-HT3 receptor antagonists are mostly preferred. Apart from that, dopamine receptor antagonists like prochlorozine and promethazine are preferred. So prochlorozine is a dopamine receptor antagonist and promethazine is an anticholinergic as well as antihistaminic drug. So, vomiting of varied origin, or else we can say simplify as drug-induced vomiting. So, there are various drugs which have the side effect of nausea or vomiting. So, when these drugs are taken for chronic period of time or for longer use, then emesis is caused as a side effect because of that particular drugs. And this is because of the increased intracranial pressure in the patient. So, for example, we can say that CNS drugs. So CNS drugs, when CNS drugs like anti-epileptics or antidepressant drugs or we can say CNS related drugs, whatever it may be, and if these drugs are given to the patient because of overstimulation of CNS also, or there will be some pressure created in the intracranial region. So when this pressure is created in the patients, then the CTZ activates and stimulation of the CTZ induces vomiting in that particular patients. And in the patients who have brain injury or else who have undergone some sort of surgery related to the brain or tumor surgery, because of the cerebrospinal fluid pressure or as the fluid which is created by the CSF, the pressure which is created by the CSF, that is cerebrospinal fluid, because of that also the CTZ activates and emesis is induced. So in this condition, the drugs preferred are nabilone and dronabilone. These are the drugs which are preferred in drug-induced emesis. How this vomiting can be controlled, or else where is the region of controlling of this vomiting? So the vomiting center can be controlled by the inputs, I mean the signals which are sent or else which are received, the input as well as output of various regions. as I told you, there are various centers which are caused, or as various centers or various regions which are getting stimulated and emesis is induced. So when by controlling of these regions, the vomiting can be controlled, or as the vomiting center can be controlled, and thereby the emesis can be reduced to some extent. So if we see the various regions which are caused, or as where disturbances occurs, for example, if there is any disturbance in the vestibular region or CNS region or GIT region, as well as if there is any disturbances caused because of muscarinic as well as histaminergic and serotonin receptors also, this emesis is induced. But by controlling all these regions, whether it may be drug induced or naturally occurring products also, we can control these particular regions, and thereby the overstimulation or any disturbances created in these regions can be controlled, and thereby the excessive stimulation of CTZ can be controlled and vomiting can be reduced, or else it can be controlled. First one, stimulation of the CTZ. So as I told you, this CTZ is present in the medulla oblongata region of the brain, or else area posterior region of the brain, and this chemotrigger zone is present outside the blood-brain barrier, and it has various receptors. So on activation of these receptors, for example 5-HT3 receptors, if serotonin, there are various neurotransmitters present in the body like acetylcholine, epinephrine, norepinephrine, adrenaline, noradrenaline, serotonin, dopamine, etc. GABA also. There are various other neurotransmitters present in the body. So this serotonin, if it binds to 5-HT3 receptors, then it exerts its actions or show its effects. So it has various effects on smooth muscle, cardiac muscle, on chemotrigger zone, or else various on heart rate. It shows various effects. So at the same time, if acetylcholine when binds to muscarinic receptors which is present on the CTZ, then also it shows effects. So it is based on the neurotransmitters also which go and bind to that particular receptors. So on preventing or else on inhibiting these neurotransmitters to bind to those particular receptors, then we can control the overstimulation of CTZ. It is stimulated by, how CTZ is stimulated? So it is stimulated by various drugs. For example, opioid-like drugs, opioids and its derivatives, because of general anesthesia, because of L-DOPA. So these are few of the drugs which causes stimulation of CTZ, because CTZ contains receptors, so these go and bind to that receptors. And chemicals and toxins. So we have discussed in the first slide itself T in the spelling vomit. T stands for toxins. So if there are any toxins which are causing irritation to blood or cerebrospinal fluid or blood-brain barrier or intracranial region, then also this CTZ is stimulated. The other one is radiation. So chemotherapy we can say. So if there is any radiation given to that patient, whether it may be for chemotherapy or whether it may be laser treatment or any other treatment, if there is any radiation given to that patient, then CTZ is stimulated. The other one is uremia. So this is a condition where urea or uric acid increase takes place in the body. So in that condition also CTZ is stimulated. The other one is the periphery via sensory nerves. So in GIT irritation condition or myocardial infarction condition or renal or biliary stones. So these are like diseased based conditions we can say. So in these diseased based conditions, it causes disturbances of GIT or it causes disturbances to the heart. So myocardial infarction is a condition where the myocardial tissue is replaced by the fibrous tissue. So this myocytes or myocardial tissue is not available. So there causes heart failure, or else we can say congestive heart failure is caused. So in that condition, the cardiovascular system is not functioning properly. And in GIT irritation, because of the irritation caused to the GIT region, there occurs disturbances in the GIT. And renal or biliary stones, when these stones are formed, kidneys won't function in a proper way. So in this is the conditions, the sensory nerves won't send signals or receive signals. The input and output of the signals will be almost nullified modified or reduced. So in that conditions also the CTZ will be activated. The other one is disturbance of vestibular region. So if there is any disturbance in the eye or ear region, and one reason might be because of motion sickness. So in motion sickness condition, because of the activation of or else because of the action which is shown by histamine as well as muscarinic receptors. So in motion sickness, what happens is like because of the anxiety or because of the patient condition, the acetylcholine as well as histamine are released into the circulatory system. So when these are released, they go and bind to that particular receptors and exert their action. So in this condition also CTZ is stimulated. The other one is high cortical center stimulation. That is, in short, we can say CNS stimulation. So it is related with emotion factors. So if a person is highly emotion or else if he feels depression also, there might be chances of stimulation of CTZ in few of the patients. And in some conditions, like if it don't occur normally in all, but in most of the cases, if we feel any or else if we smell any, if we feel like any bad odor or nauseating smell also, we feel like vomiting. What is the pathophysiology behind this emesis, or else what is the mechanism behind this emesis? How CTZ is stimulated or how vomiting center is stimulated? So this is the flowchart representation, or we can say diagrammatical representation. So in the cerebral cortex region, there are various sensors. The senses for smell, the senses for sight, as well as the senses for thought also in the cerebral cortex region. And in the brain region, we have chemotrigger zone. And because of the activation of chemotrigger zone by various reasons like chemotherapy, opioids, and anesthetics, which is present outside the blood-brain barrier, this coordinates with the vomiting center which is present in the medulla oblongata region. And this vomiting center have muscarinic as well as 5-HT3 and various other receptors. And the vestibular nuclei, the disturbances created in the vestibular nuclei because of motion sickness, that also coordinates with the vomiting center, and thereby because of the activation of this vomiting center, the emesis occurred. And here we can see the pharynx and GIT, that is the disturbances created in the peripheral region or peripheral system, that is pharynx and GIT, where 5-HT3 receptors are present. So here because of the chemotherapy as well as the gastroenteritis, this is inflammation of the GIT. Gastroenteritis is a condition where the inflammation of the GIT takes place and there will be nullified peristaltic movement of the GIT. So in that condition also the 5-HT3 receptors get activated, serotonin is released and it exerts its actions, and whereby vomiting center is stimulated. What are the chemical transmitters or receptors which are involved in the emesis? So what are the neurotransmitters? There are various neurotransmitters present in the body, but all don't involve in emesis. There are few chemical mediators in the body which causes emesis, like acetylcholine, which binds to the muscarinic receptors, and dopamine, which binds to the D2 receptors, histamine, which binds to the histaminic receptors, serotonin, which binds to 5-HT3 receptors, and substance P, which binds to the neurokinin receptors, and the other one is opioids or opioid derivatives, which binds to the opioid receptors. Let us see the classification of antihemetics. So what are the drugs which are used to treat emesis? So first category of drugs are 5-HT3 receptor antagonists. So emesis is called because of stimulation of 5-HT3. So 5-HT3 receptor antagonists are preferred, like ondansetron, granisetron, dolasetron, tropisetron, ramosetron, palosetron. So these are few of the drugs which are preferred for which are preferred as anti-emesis. The second category of drugs are centrally acting dopaminergic receptor. So a dopaminergic receptor also there are two types, centrally acting and neuroleptics. So centrally acting dopaminergic receptors are preferred for emetics. So in neuroleptic condition, type of dopaminergic receptor antagonist, they act only in the particular CNS region. They are not acting overall in the body. So whereas the centrally acting dopaminergic receptor antagonists, when they bind to dopaminergic receptors, they exert their action all over the body. The second category of these antiemetic drugs are centrally acting dopaminergic receptors. So in dopaminergic receptors also there are two. One is centrally acting, the other one is neuroleptics. So centrally acting dopamine receptor antagonists are those which bind to the D2 receptors and exert their action all over the body. Because emesis is caused because the disturbances which are created in various organs of the body. So that is the reason centrally acting D2 receptors are most preferred. Receptor antagonists are most preferred when compared to the neuroleptics. So in neuroleptics, they act only to the CNS region, whereas when they bind to the D2 receptors, they exert their actions which is restricted to only central nervous system region. The drugs which come under this category are metoclopramide, domperidone, chlorpromazine and prochlorperazine. And the next category of drugs are histamine receptor antagonists. So histamine is one of the allergen which is released from the mast cells which are present in the body. So this histamine, when bind to the histaminergic receptors, particularly to H1 receptors, these have various effects. So the histamine receptor antagonists, when preferred, they nullify the action of the histamine, and thereby they can act as antiemetic drugs. So the drugs which come under this category are ciclizine, promethazine, diphenhydramine and hydroxyzine. The next category of drugs are anticholinergic drugs or muscarinic receptor antagonists. So in cholinergic receptor also there are two types of receptors. One is muscarinic and the other one is nicotinic receptors. So in this particular emesis or else in antiemetic condition, muscarinic receptor antagonists are preferred because emesis is not caused because of the acetylcholine binding to nicotinic receptors. It is caused only when ACH is binding to the muscarinic receptors. So that is the reason muscarinic receptor antagonists are preferred as antiemetic drugs. And the drugs which come under this category are hyoscine, which is also called as scopolamine. And this hyoscine or scopolamine is a preferred or as drug of choice in motion sickness. The other one is neurokinin receptor antagonist. So this neurokinin receptor, that is substance P. Substance P is an allergen or a chemical mediator which is released into the body, and it binds to the neurokinin receptors, particularly to NK1 receptors. So the drug which antagonizes the substance P action is that aprepitant. The other one is cannabinoid receptor antagonist, cannabinoid receptor agonist. So cannabinoids also, there are cannabinoid receptors which are present in the body. So these agonists which when bind to these cannabinoid receptors, they exert antiemetic actions. The drugs which are used are dronabinol and nabilone. These are particularly used, or these we can say these are drug of choice in morning sickness. The other category of drugs are corticosteroids. So these corticosteroids also have various actions in the body when they get released into the body. The drugs which are used as an antiemetic drugs of corticosteroid class are betamethasone and dexamethasone. The other one is vitamin B6. So vitamin B6 is more, we can say this, which is also a drug of choice in morning sickness. And the other one is phosphated carbohydrate solution. This is also used as an antiemetic drug. Let us see the first class of drug, pharmacology of first class of drug, that is 5-HT3 receptor antagonist. So here we can see in the second column we can see the overall mechanism of all 5-HT3 receptor antagonists. So 5-HT which is released, that is serotonin, which is released into the body, and this serotonin is released from enterochromaffin cells which are present in the body, especially in the small intestine region. So in the small intestine region, this enterochromaffin cells, when serotonin is released out of these cells, it go and bind to the serotonin receptors and exert these actions. So this serotonin release is mainly because of the chemotherapeutic agents which are present in the body. And here when these serotonin it binds, then it gets stimulated. It has various actions. When coming to particularly in CTZ region, when it binds to that 5-H serotonin receptors which is present on the chemo trigger zone as well as in the vomiting center, it sends some reflexes and thereby vomiting is induced. So in that when we antagonize the action of this serotonin, the nausea and vomiting can be reduced to some extent. So the first category of drug is ondansetron. It is a pro-type drug. Pro-type drug in the sense, as when the formulation is given, it is in the inactive form, that is pro-type form. So on some chemical reactions or some biotransformation reactions, the inactive form is converted to active form, and the active form shows the antiemetic action. The pharmacokinetics of these drugs. So what is the pharmacokinetic of ondansetron? So this ondansetron have a peculiar character that generally the drugs which when eliminated out of the body, they don't exert their action. If the drug is present in the circulatory system only, it shows its action. But this ondansetron, as it is a pro-type drug, when it is eliminated out of the body completely also, its action is present in the circulatory system for almost few days. We can say up to 2 days, even the action of ondansetron is present in the circulatory system, even it is eliminated out of the body completely. The other one is it is well absorbed in the GIT. So when compared to other parts of the region, other parts of the body, it is well absorbed in the GIT region, especially we can say intestinal region, and it is metabolized by various cytochrome enzymes. So there are various cytochrome enzymes which are present in the liver, like cytochrome P450, cytochrome Y enzymes. So these are the enzymes which are used in the metabolism of various drugs. So this ondansetron is metabolized by these cytochrome enzymes which are present in the liver. And what is the use of this ondansetron? Especially, or as we can say, what is the when this ondansetron is used as drug of choice? So this ondansetron is used as a drug of choice in chemotherapy-induced MSS. And this ondansetron has few of the side effects, like common side effects like headache, and in some conditions it may cause constipation or diarrhea, depends on the patient. Let us see the next drug, that is granisetron. So this granisetron, it is normally eliminated. In the half-life of all these drugs is about 2 days, and after that it is getting metabolized in the liver and it is completely excreted out of the body. The use, when does this granisetron is used, or the whatever it may be, granisetron as well as dolanesetron. So these are the two drugs which are metabolized in the liver, and they are used as a drug of choice in chemotherapy-induced vomiting, as well as they are used as a drug of choice in the emesis which is created because of the GIT irritation, as well as in the in the emetic conditions which is caused in the pregnancy, that is we can say morning sickness. So in this morning sickness condition also this granisetron and dolanesetron are used. And what are the adverse effects of these? So all 5-HT3 receptor antagonists have common side effects, that they cause headache, common side effect, and the other one is it causes constipation or diarrhea depending on the patient. And the other drug is palinosetron. So this palinosetron, it is metabolized in the liver by the enzyme called as cytochrome P2D6. So there are various cytochrome P enzymes. So one of the type is that cytochrome P2D6, and there is the other enzyme called as cytochrome P450, where most of the NSAIDs and other category of drugs are metabolized by this cytochrome P450. And this palinosetron is eliminated out of the body through urine. And this palinosetron, it is used in the delayed emesis because of the half-life of the drug. If any particular drug is, we can say drug induced, it is the drug of choice in drug induced emesis. So in most of the drugs, if the drugs have longer half-life, or else if the drug is retained in the circulatory system for longer period of time, then this drug induced emesis is caused, and palinosetron is first choice of drug in this drug induced emesis. The second category of drugs are D2 receptor antagonists or dopaminergic receptor antagonists. So the dopaminergic receptor antagonists, as I told you, they exist in two types, that is prokinetic drugs as well as neuroleptic drugs. So this dopaminergic receptors are present in the CTZ region. So when this dopamine action, or else when this dopaminergic receptor action is blocked, then the overstimulation of CTZ can be controlled. Let us see the first type of dopaminergic receptor antagonist drugs. Those are prokinetic drugs. So these prokinetic drugs, they act centrally. We can say centrally acting drugs. So the drug which come under, one of the drug which come under this category is metoclopramide. There are various other centrally acting drugs also. So but first preferred drug is metoclopramide. So this centrally blocks D2 receptors. It does not allow the dopamine to bind to the D2 receptors, or we can say that it blocks the D2 receptor actions which is present in the CTZ, whereby overstimulation of CTZ can be controlled. And it is used in the nausea and vomiting which is caused because of the GI disorder. If there is any disturbance in the GI disorder and the emesis which is caused because of these disorders, the metoclopramide is first choice of the drug. And the other one is in post-operative conditions also. If there is the emesis or else the vomiting which is induced or caused because of the post-operative surgery or post-operative surgery conditions, this metoclopramide is used. What are the side effects of these metoclopramide? So first side effect is like dyskinesia. Dyskinesia is a condition where abnormality of movements of smooth muscle takes place, or else if there is any abnormality in the involuntary muscles, then this dyskinesia condition is caused. And the other one is galactorrhea, menstrual disorders and impotence. These are the side effects of metoclopramide. And in some conditions or else in severe conditions, it may cause sedation as well as postural hypotension. The second drug of prokinetic category is domperidone. So this also binds centrally to the D2 receptors which are present in the CTZ. But this basic or its main advantage of this domperidone is it does not cause the blood-brain barrier. So what happens if a drug crosses the blood-brain barrier? So this blood-brain barrier, that is BBB is a protective layer for the brain. If there are any drugs which is crossing this BBB, then they act directly on the central nervous system, and there are chances of whether overstimulation or low stimulation, that is, we can say disturbances occurring in the central nervous system. So this domperidone, it does not cross BBB and thereby does not show any disorders or disturbances which is related to the central nervous system. This is the best part of this drug. What are the side effects? So what are the side effects of domperidone? It has common side effects like headache and diarrhea, and sometimes it may cause dryness of the mouth. The next category of D2 receptor antagonists are neuroleptics. So neuroleptics are the drugs which act only in the CNS region, or else we can say in the central nervous system only these drugs are active. So the drugs which come under this category are chlorpromazine and droperidol. So these are the drugs which are used as a neuroleptics, and these neuroleptics are preferred or in some conditions, or else we can say if the drugs, if a patient is tolerant to the centrally acting D2 receptors, then these neuroleptics are preferred. Or else, if there is any, we can say, if the drugs have the chances, if a patient is suffering from the CNS disorders already, then this centrally acting receptors and centrally acting D2 receptor antagonists are not preferred. So in that condition, these neuroleptics can be given to that particular patient, because these neuroleptics, they never cross blood-brain barrier, and these are used mainly in the post-operative induced emesis or vomiting, or in some cases it is also used in chemotherapy induced emesis. Now, what are the side effects of these neuroleptics? So the side effects of these neuroleptics are extrapyramidal side effects. So extrapyramidal side effects are the sense if there is any disturbances caused in the sensory organs or vestibular region, or to the cardiovascular region, or to the GIT region, if there is any disturbances caused, so then if there is any disturbances caused in the smooth muscle of this particular particular systems, then these extrapyramidal side effects are occurring. The other one is sedation, and the other one side effect of these neuroleptics is postural hypotension. The other category of drugs are H1 receptor antagonists. So histamine or else H1 receptors are present in the CT cell. So when histamine go and bind to these H1 receptors, it shows the action of, or else it stimulates the vomiting center and causes emesis. So this H1 receptor antagonists are given as, the drugs which are given for this antiemetic drugs are diphenhydramine, meclizine, ciclizine and promethazone. Especially these H1 receptor antagonists are preferred in motion sickness as well as morning sickness. So, what is the mechanism behind the histamine receptor antagonist? So here we can say when this histamine binds to the H1 receptors, it shows cholinergic actions also. So when histamine go and binding to the H1 receptors or even acetylcholine binding to that H1 receptors, then cholinergic actions are shown. So one of the cholinergic action is activation of this or else increased contraction of the smooth muscle, activation of the heart muscle, that is increased the heart rate and force of contraction. The other one is stimulation of the CT cell. So these are few of the actions of histamine as well as ACH, or we can say cholinergic actions and histaminergic actions. So when these actions are inhibited by this H1 receptor antagonist, then the overstimulation of CT cell can be controlled and this shows antiemetic effect. So here we can see the diagrammatic representation. Here the mast cells, the cells from where the histamine is released. So when mast cells release histamine, this histamine which is shown in the blue coloration, it goes and binds to the histamine receptors. So when these antihistamine drugs, they block or else it won't allow the histamine to bind to that histaminergic receptors and exert this action. So this is the way how they act as antiemetic drug. What are the side effects of these H1 receptor antagonists? So they have the prominent sedation effect. So when these histaminergic receptors are given for a longer period of time, or else if we take in a heavy dose, they cause sedation. The other one is they cause hypotension. The other one is they cause anticholinergic effects. So anticholinergic effects, the main anticholinergic effects are dry mouth as well as blurred vision. So any drug which have anticholinergic effect as a side effect, then we can see the patients having dry mouth as well as blurred vision, and in some conditions they may cause constipation as well as urinary retention also. The next category of drugs are muscarinic receptor antagonists, or else we can say anticholinergic drugs. So these muscarinic receptor antagonists, they prevent the binding of ACH to the muscarinic receptors. So the drugs which come under this category is only one drug, that is hyoscine or scopolamine. This is the drug of choice, or as we can say first line drug which is used in motion sickness. And this hyoscine or as scopolamine, it is given orally or else it is given intravenous. But intravenous is more effective when compared to oral, and this is a labyrinthine type of drug, in the sense the drug which is used, because as I told you, it is the emesis or the emesis which is caused in the motion sickness, it is not regular, it occurs in the irregular basis. So we can't predict when does the patient is prone to emesis in motion sickness. So in that condition, this hyoscine is also, we can't give that drug in all, or else we cannot prefer that drug in all traveling conditions. So when we feel the emesis or when we feel nauseating while traveling, then this hyoscine can be taken. And this hyoscine is also formulated as transdermal patches. So if a person is not willing to take tablet or IV, because it's not easy, or else there won't be any doctor beside us while traveling. So if a person is not palatable, or else if he is not comfortable in taking the oral tablets, then the transdermal patches are available. So these hyoscine patches, if we just apply those patches on the skin, then that hyoscine, it directly enters into the blood circulation via penetrating into the skin layers. So in that way it exerts its actions, and this is mainly used in post-operative, or in some cases it is also useful in post-operative surgery induced emesis. but it is not used in chemotherapy induced MSS, because in chemotherapy condition we give anti-cancer drugs also. So hyoscine is one of the anticholinergic drug which is contraindicated in cancer patients, or if a person is using anti-cancer drugs, then hyoscine is contraindicated. What are the side effects of these muscarinic receptor antagonists or anticholinergic effects? So the main anticholinergic effects, as I told you, dry mouth, blurred vision, urinary retention, constipation, and in some cases dilated pupil. The pupils will be dilated. And the other one is tachycardia. That is, tachycardia is decreased force of contraction of the heart. The next category of drugs are neurokinin receptor antagonists. So substance P is one of the chemical mediator which is released into the body, and the substance P, it binds to the neurokinin receptors or NK1 receptors which are present in the body. So on these NK1 receptor antagonists or neurokinin receptor antagonists, they don't allow the substance P to bind to the NK1 receptors and exert their actions. So these these drugs are mainly used in the, we can say that, chemotherapy induced MSS. In chemotherapy induced MSS, this NK1 receptor antagonists are preferred. So if a person is taking cisplatin, anti-cancer drug, so this cisplatin has a side effect of MSS. So this MSS, or else we can say this phase, occurs in two phases, that is acute phase as well as chronic phase also. We can say if cisplatin is used for acute period of time, that is within 24 hours of chemotherapy and all, and delayed phase is like in some patients, if they are taking for 2 to 5 periods, or chemotherapy is taken for 2 to 5 periods along with cisplatin, then this MSS is induced. So in that condition, neurokinin receptor antagonists are mostly preferred. So the drug which is used as an NK1 receptor antagonist is aprepitant. So this drug, it acts by blocking the NK1 receptor. So it won't allow the substance P to bind to the NK1 receptors. So it blocks the action of the NK1 receptors, and thereby it is stopping, or else it is showing its antiemetic effect. And this NK1 receptors aprepitant is mostly given through oral route only. It is not preferred, or else we can say it's not preferable to give in any way. The other one, because if we give in other routes of administration, it may have adverse effects, and it is usually combined with 5-HT3 receptor antagonists in order to show effective results. Here we can see the mechanism of action, that there is diagrammatical representation. The substance P which is released, and there is another substance also, neurokinin A. So when the substance P is released, it goes and binds to the neurokinin, that is NK1 receptors. Substance P binds to only NK1 receptors, but neurokinin A, it binds to the NK2 receptors. So when the substance P binds to the NK1 receptors, there occurs increased nitric oxide levels, and when this increased nitric oxide is released into the body, it causes relaxation. And when these increased eicosanoids are 20 carbon polyunsaturated fatty acids, like the drugs, the substances like prostaglandins, leukotrienes, these are few of the eicosanoids which are released in the body. So when increased nitric oxide as well as when prostaglandins or these eicosanoids are released in increased amount, it causes relaxation. So because of this relaxation of the smooth muscle, then stimulation of CTZ takes place. So in that condition, this emesis is induced. So when this substance P, when this blocking of the substance P to the NK1, binding of the substance P to the NK1 receptors is blocked, then the overstimulation of CTZ can be reduced, showing the antiemetic effect. The other category of drugs are cannabinoids. So there are cannabinoid receptors also which are present in the body. The drug which is used as a cannabinoid receptor agonist is dronabinol. So dronabinol is a naturally occurring cannabinoid. We can say it is a plant derivative drug. So this cannabinoids, what does they do is like, there are cannabinoid receptors. There are CB1 receptors, CB2 receptors which are present in the body. So this drug dronabinol, which binds to that receptors, it stimulates the CB1 receptors. So these are acting as an agonist but not an antagonist. So when this stimulation is occurred, then it causes the decreased stimulation of CTZ, and thereby the emesis can be reduced. What are the pharmacokinetics? So this dronabinol or as cannabinoids, these are highly lipid soluble drugs. Most of the 95% of the drugs are water soluble drugs, but there are few drugs which are water insoluble, or as we can say lipid soluble drugs. So the advantage of these lipid soluble drugs are they can easily cross any cell membrane, because these cell membranes are made up of phospholipids. So in water soluble drugs, in order for the drug to cross that cell membrane, it needs some sort of carrier in order to enter into the cell membrane. But these lipid soluble drugs, they does not need any carrier and they can directly penetrate into the cell membrane. So these are highly lipid soluble drugs, and the onset of action is about 1 hour. I mean, once the drug is administered, within 1 hour its action will start, and a peak actions of these cannabinoids can be observed within 2 to 4 hours, and these cannabinoids are eliminated in the urine. What is the use of these cannabinoids? See, these cannabinoids are mainly useful in the prophylactic, it is used as a prophylactic agent in chemotherapy induced emesis. And what are the adverse effects? So these cannabinoids have the adverse effects related to the CNS. So they causes some complexes, or else they causes some complications in the CNS. For example, we can say central sympathomimetic effect. Sympathomimetic effect is nothing but the adrenergic effect. So if drugs, when acting on the autonomic nervous system, or we can say adrenergic nervous system, then the activation of the adrenergic sympathetic system. In adrenergic nervous system also we have two, sympathetic as well as parasympathetic. So when this sympathetic adrenergic nervous system stimulation is caused, it causes the various effects. So this is one of the side effect of this cannabinoids. The other side effect is it causes palpitation, it causes tachycardia, vasodilation and hypotension. In some conditions it causes abrupt withdrawal. That is, if we are taking, or else we are taking a drug as a course, and if we withdraw that, we stop using that drug suddenly, then it causes withdrawal syndrome. But this withdrawal syndrome is not observed with all the drugs. For example, we can say opioids. So opioids should not be we can say we should not stop taking opioids all at once. We should reduce the dose of the opioids in a regular basis, and then we can stop consuming opioids, because opioids are few of the drugs we can say they are used as a drug of abuse or as drug addiction. So we get addicted to opioids. So in that condition, in order for the patient to get in order to prevent the patient to get addicted to these drugs, these opioids should be reduced, or else the dose should be reduced, and regularly they have to stop, so that the person cannot suffer from any withdrawal syndrome. But these cannabinoids, these cannabinoids have side effects of withdrawal syndrome. If we stop using these cannabinoids all of a sudden, then they cause withdrawal syndrome. The other category of drugs are glucocorticoids. So in glucocorticoids, we have dexamethasone and dexamethasone and betamethasone. So this dexamethasone is mostly preferred as an antiemetic drug, and this glucocorticoids are we can say they are used in mainly chemotherapy induced vomiting. So the emesis which is caused because of the chemotherapy conditions, then these corticosteroids are mostly preferred. And in order for the corticosteroids to show to show more effect, or else to be effective, they are combined with other drugs like 5-HT3 receptor antagonist, NK1 receptor antagonist. So when the combination of these drugs are given, then it shows synergistic, or else we can say the effect is the actions which are shown by these drugs are very effective. And what are the side effects of these glucocorticoids? So these glucocorticoids have main side effects like cataract. Cataract is a condition where cloudiness of the eyelids takes place, or else the eyelids, through eyelids only we can see. But when cloudiness is caused to that eyelids, then the vision of that particular person is not proper. So cataract is caused. Hyperglycemia, the blood sugar levels or blood glucose levels are increased. Hypertension, Osteoporosis. Osteoporosis is a condition where the bones become soft and fragile and easily breakable. And increased intraocular pressure, increased susceptibility to infection, and increased appetite and obesity. So these are few of the side effects of these glucocorticoids. But in few of the when these glucocorticoids is given at higher dose, in few cases in females they may cause sterility. Phosphated carbohydrate solution. So this is a combination of glucose, fructose as well as phosphoric acid. So in MSS, as electrolytes are lost out of the body, in order for the person to regain these electrolytes, this solution is mostly preferred. Oros also can be preferred in nausea and vomiting, but this solution is more effective when compared to Oros. So this, as glucose and fructose, when they entered into the body, they regain the electrolytes. So this is a very, we can say, very effective solution when given to the MSS patient, and it is used only for shorter period of time. This is not recommended for chronic period. The other one is like vitamin B6 or pyridoxine. So if there is any deficiency in the pyridoxine, also the MSS is induced. So in that condition, the vitamin B6, especially for pregnant women, in or else we can say in morning sickness, this vitamin B6 is mostly preferred as an antiemetic drug.